Hello, I'm Dr. Brent Gibson, and today I want to talk to you about nerve repression. The idea of nerve repression is not fixing the nerve, not um, changing the symptoms in any way other than just repressing them, making it so that you don't feel them, so they don't interfere with you on those hard days. So, a lot of times with peripheral neuropathy, you've got the situation where you initially start with some discomfort that becomes severe enough it starts to distract you from the things you're supposed to be doing, and the distraction gets bad enough that it gets to the point where it's a disability. And the idea is the disability, we need to treat it to get you back to where it's just a distraction. And then repression is a valuable tool for those days when the distraction or the discomfort is interfering with you being able to function like you're supposed to. So the idea, if you remember, we've talked about multiple different ways that you can actually treat peripheral neuropathy. You can do a re-education, you can do a reset, you can do a repair, and we'll talk about repair later. But right now, I want to talk to you about the nerve repression process. And there's really a couple different groups on how you can actually repress nerve symptoms. The most common used treatment for peripheral neuropathy is medications, which are designed to repress the nerve. Whether it's narcotic pain medication, whether it's just the anti-inflammatory type pain medication, or whether it's nerve modifying medications, all are designed to repress the nerve, to keep the nerve from having the feelings, keep the nerves from having the sensation, keep the nerves from being able to do things, but they're not treating the nerves in any way. So Lyrica, for example, is repressing the nerve. And in some individuals, it works really well, especially at night. But the side effects oftentimes make it so it's not something that you want to be on forever. The second group are topical type medications where you actually can use things to treat the symptoms to repress it as well. These topicals can be anything from the essential oils to biofreeze to arthritis type creams to CBD oil where you can actually rub in. Now, technically, CBD oil also fits in the repression for medications because you can actually take it orally and it will do the same thing. It will repress the symptoms. And the third type is things that you can physically do. There are things that will repress nerve symptoms. Certain types of exercises a lot of times can repress nerve symptoms. Certain types of meditation can repress nerve symptoms. And a lot of things, what we're doing at this point is we're saying, okay, let's give you some tools mentally, whether it's self-hypnosis, whether it's a process called becoming unhackable, where you actually take control of what the brain is doing so you can actually get yourself into flow, which will cause you to not notice these symptoms, basically a disassociation type of repression from the neuropathy pain. All of these are designed to give you tools that you can say, okay, in this situation, I'm going to use trigger point repression, or in this situation, I'm going to do massage because it actually helps repress the symptoms. In this situation, I'm going to use self-hypnosis or meditation. And the idea is just to know when to use different things and when you're going to use the lotions or the topical treatments. And truthfully, in most of the times when I treat peripheral neuropathy, I don't use most of the medications because of the possible significant side effects. But basically giving you tools so that you can actually repress the nerves. You can actually change the way the nerve symptoms are presenting to you so you can continue to function. This is Dr. Brent Gibson, and this is your Neuropathy Nugget Day 234, nerve repression as a special tool for those especially hard days of peripheral neuropathy. Thank you. Have a great rest of your day.